My name is Dr Sindisiwe van Zyl. I'm a GP and media personality with a special interest in HIV and women's health.
We live in a country that recognizes everybody regardless of your gender, your race, or your sexual orientation. So yours is not to judge or to question their choices. Yours is to help them with the healthcare that they need.
Certain problems may be especially hard for patients to discuss with their healthcare providers. Gender and ethnicity can be factors in patients' hesitancy to communicate about these issues.
You are going to meet people that are not necessarily of your sexual orientation, and you have to be sensitive around that. So you will come across men who have sex with men, women who have sex with women. You might come across a person that's transgender or someone that's bisexual. Race is also an issue. I think in South Africa, we are quite sensitive about matters of race. And I speak about race in the sense of be mindful of what you're saying, be mindful of how you refer to certain conditions or how you refer to the HIV pandemic as a whole. Culture is always a tricky one. We grow up being taught to be very respectful towards women who are older than we are, especially the black women. So obviously if an older black woman comes in and we have to have the sexual discussion, I have to be mindful of my words. So I won't always use the terms that I'd use with a younger person, but I still have to get the information out of them. So just work out in your head how you'd get information out of your grandmother, for example.
Learning a few common words and phrases can be a useful way to communicate with patients in their language, and it's also more likely to persuade them to visit your pharmacy again.
Ageism might be a challenge for many of us, so do remember that if that comes up, be as sensitive as you can, be as respectful as you can, and always keep the end goal in mind. What do you want from the consultation? You want a patient to receive the correct information to make the right decisions about their health. HIV can happen to anybody. It's got no way of choosing, socioeconomic status or what career you are in. So please make sure that you're sensitive around those discussions.
For Each Other is our commitment to an HIV-free future. Share your story on #ForEachOther. Connecting keeps us strong. Find out more at www.foreachother.org.za.